Hi, my name is Alicia Mylander. I'm the RN Clinical Manager on the Inpatient Oncology Unit at ThedaCare Appleton. I just wanted to take a couple minutes to talk to you guys about my career path up to this point, and our patient population and our floor culture. So I had the luxury of starting my RN career on this unit. Prior to that, I worked in long-term care as a certified nursing assistant and an LPN. About 7 years ago or so, I started here, and I transitioned into the charge nurse role after a couple years, and then transitioned to the patient care supervisor role. And then recently, in the last year, I was able to transition into the manager role. I'm thankful to ThedaCare for all the opportunities for the development and collaboration from my colleagues to help me achieve this and get here. Our patient population, we have a great population mix. We have all oncology patients that come to the hospital. If we have a bed come here, whether it's for medical reasons, for surgical reasons, or if they're here for inpatient chemotherapy. Also, we are the primary unit for respiratory patients. And as always, we get medical overflow when needed to meet the needs of our community. Finally, I want to talk to you guys about our floor culture. I'm a little biased, but obviously I think we have an awesome culture on our unit. We start each shift with a start a shift huddle to really set our team up to know what's going on with a quick safety check. And then Monday through Friday, we do a 7 o'clock huddle with the team to really keep people in the know of what's going on and to talk about how we can improve things and make things better on our unit to really take care of our patients and keep everyone in the loop in real time. And then also we have a high functioning local unit council that uses input from the whole team and to make improvements, and when applicable to make them system-wide improvements. So that's been really exciting to see our team be able to lead through things of that nature.
This is the view when you're coming off the elevator to go to work. It's the morning, so things are quiet. Knock on wood. Hallway. We've got a waiting room here for our visitors. When we have visitors, they can sit here, relax, work on the computer, watch some TV. This is a patient's room. Over here is a nurse server, which has everything from linens and to hygienic needs and some blood draw supplies and IV starts, isolation gowns. Below we have linen and a stool. These are linen bags for dirty linen. Over here in our closets, we've got a refrigerator behind this door. We have a safe for patients' lockups in this drawer, and the rest is just storage, and then extra pillow. As we move across the room, we have a sink for good hand hygiene, and we have our whiteboard here. So this will tell the patient the date, the room number, their phone number. On the care team side, we'll have the doctor, the nurse, and any other members of the care team that are relevant to this patient. We've got the number to dial for food and their diet, and pain scale, fall risk up there if they need alarms or not, and then as needed meds like for pain. This is important to keep updated so when we come into a patient's room, we know kind of what the plan is and how to take care of that patient. This, as you can see, is a tray table. We've got a nice recliner, and then our fancy bed. First cabinet, we've got a suction gauge and air and then oxygen. Behind this other cabinet, we've got another suction gauge and oxygen regulator, and then we've got a thermometer. We have our call light, which also controls the television. Over here we have an Alaris pump for IV stuff, Dynamount for blood pressure, an oral temp and pulse oximeter. We've got a Sharps container, our scanner for our medications, and this computer. This is our bathroom, and this is a sign we have on our doors. So if someone does come and answer the light and the patient needs to go to the restroom, we can look at this chart and know how best to keep our patients safe and from falling. And this is the patient's bathroom. There's a commode needed. We have a shower here. And then of course, the toilet. This is our AccuCheck and also our call light system. We can check blood sugars, and also there's the call light system where we can see who's on their call light. This is our communication board that our leader goes through in huddle, and this tells us how we're doing with our scores and our falls and latest projects that are going on and updates. Here's our celebration board. On the other side we have also more celebrations, new hires, and then this is the what's happening side of everything. And that's our manager's office. This work area has the keys, it has bands, pins, extra supplies, prints off labels, armbands, and can also print out forms. This is our clean equipment room. We've got pillows and pads and supplies, respiratory, and all kinds of things that you would need to help take care of your patient. We've got oxygen tanks, more supplies. We got the pump again, and here's another Dynamap. Here we have the SCD machines and some extra walkers. This is our vein finder. This helps us find veins so we can find a place for an IV. And next to that is our code cart. In front of us is the linen cart, and we try to keep this closed. Inside we have towels and bed change linens and clean gowns. This is where the AA sits. We've got our Daisy Award box here. Here she sits here. And we have empty charts and all the things that are needed to help take care of our patients and get them where they need to go. Something that's unique to our unit is we have a chemotherapy spill kit. There's everything in here that you would need if you had a chemotherapy spill. Another unique item on our floor is this inpatient oncology bell, which is for our patients who have completed their chemo regimens. On their discharge date, they get to come and ring the bell.
Hello, I'm Katie Menon. I'm a new grad here at ThedaCare in Appleton. I'm working on the oncology floor right now. I went to school at Chippewa Valley Technical College in Eau Claire and got my 2-year degree in nursing, and I soon plan to go back to get my BSN. I picked this floor because I wanted to get the med-surg clinical skills, but I also wanted to learn more about a specialty. It was to transition into a new grad nurse from a student nurse was overwhelming at times, but because you were learning so much and absorbing so much information, but as I went through orientation, it got easier. Some tips that I have for grad nurse is to never stop learning, to go home and look the things up that you didn't know throughout the day. I love the support and encouragement from all my coworkers and management. They're always there, always are helping me learn, and that's super nice and helpful. Some advice I have for some nursing students would be to take advantage of every opportunity and to put yourself out there.